Welcome to Open BXRX Tuesday on BronxNet. I'm your host, Sonyi Lopez, and I'd like to invite you to get social with us at BronxNet TV on Instagram and Twitter, and BronxNet Community Television on Facebook. As COVID-19 cases increase due to the Delta variant, our healthcare heroes, our nurses, ramp up for yet another surge of patients in the ICU. How is one nurse mentally and physically preparing for this impending surge? Joining us now to discuss is traveling nurse Narelia Oliveras-Arzuaga. Welcome, Nurse Nare. Thank you for joining us. Always nice having you.
Hi, Sanji. Good morning. It's great to be back with you, ladies.
Good morning. So how are you and your colleagues preparing mentally and physically to handle surges of cases again a year after COVID-19 first hit the ICUs last year?
Well, Sanji, you always have such intense questions. That's very loaded, of course. And there's lots of layers to that. I think that the way we prepare is by, banding together the way we did the first time that COVID hit, and kind of looking towards our nursing community to give us support, the support that's been lacking from our healthcare system overall. And I think that looking towards social media and the communities that we have built on social media has been a huge source of just strength for us, of continued inspiration when it seems like there's very little hope. When we see such devastating and tragic cases as are seen in our sickest patients in the ICU, we need that kind of mental break and that support that we find amongst other nurses. So I really think that that's the way to get it done, and just to go back to our basic core beliefs and remember why we started our nursing journey, and remember that the reason why we do this job is to do exactly this, is to care for our sickest patients and step up when we are called to.
Thank you so much for sharing that, Nurse Nare. I know that offline we were talking about you possibly going to help with the surge happening in Florida. Can you tell us a little bit about that? And also, what can we do to avoid such a huge surge like what's going on over there in Florida right now?
Sure. I think definitely it's safe to say all eyes are on Florida right now, and it's for a good reason. When we know that 1 out of every 5 new COVID cases is in one particular state, we need to turn our resources there, and we need to look at what's happening there and understand why this variant, which we know is extremely highly transmissible and has turned out to be very deadly, why that's rising there. And so what's happened in Florida is it's a mixture of things. It is the fact that the vaccine has been politicized. And so because of that, there are lots of people that are eligible for the vaccine that have not received it. Right now, according to recent statistics, 1 out of every 8 Floridians who is eligible for the vaccine has chosen not to receive it. That means about 50 to 58% of Floridians are vaccinated, leaves a lot of people at risk. And so that coupled with the fact that Florida has such beautiful weather, that we are now in the summertime, a lot of unvaccinated people are also choosing not to wear masks in public places. And so the combination of those two things has led to an incredible surge of a even stronger variant of the COVID virus. And so they're now the nurses over there in the healthcare system is left really grappling with this new surge. And it's really difficult for them right now. Florida hospitals are really overwhelmed. ICUs are really overwhelmed. It's like we've gone full circle again, right back to where we were in the beginning. And it's truly sad.
It definitely is. And I've read also, Nurse Nada, that hospitals are short-staffed and lacking nurses for many reasons. What does this mean for nursing, and why is this happening from your experience working, at the height of the pandemic last year?
Yeah, no, that's a fantastic question. Yes, hospitals are, like I said, they're really struggling right now. The reason why they're struggling with issues such as staffing and not having adequate nursing staff to care for the ever growing number of patients is because lots of nurses decided to leave the bedside after the pandemic. They felt extremely undervalued. They felt very unsafe. A lot of nurses and healthcare workers also became sick with COVID, and then had to deal with bringing that potentially home to their families. and dealing with also just being ill with the COVID disease, which is in itself incredibly scary. So I think that all those things combined have led to a what we call mass exodus of nurses at the bedside, and that's really, it's understandable, but it's also really scary because now look what's happened in Florida. There's new needs, and now who's left to care for these patients? So what happens? Most hospitals end up relying on travel nurses and end up spending so much money to be able to fill those needs, and so there's just so much expenditure. And ultimately, as much as I love being a travel nurse, it doesn't help the patients because there's so much money that's spent. It becomes a crisis, an emergency type of situation, as opposed to having staff nurses there that are used to the system, and that are just ready to handle the surge of patients. You now end up having a crisis. And so it's difficult. It's really difficult to deal with for the patients, for us travel nurses, for the hospital. It's just a lot.
It really is difficult, and we appreciate you for being so vulnerable about this topic. You know, it's something that we don't talk about often in the media. The overwhelm that nurses are feeling after an entire year of being called healthcare heroes, and now you're feeling kind of just abandoned almost, right? So Nurse Nade, for those who don't know, nurses do much more obviously than just draw blood and check charts all day, right? Can you share the impact of nurses' work, especially during the pandemic?
Sheesh, where do I begin? I think the impact of our work, you can't measure it. There is no bar. There is nothing that we have not done during the pandemic. I think, there's all this hierarchy in healthcare, right? The doctor does this, the nurse does this job, and, the tech do these jobs. And I think that during the pandemic, all that has gone out the window. So there is nothing that we don't do. There's nothing that we haven't seen, that we haven't done, everything from, clean patients to help maintain their ventilator going, to hold their hand as they're passing, to call family members via FaceTime who can't come and see them and let them know what's going on. There's nothing that we have not done and have not seen. And if we've learned anything from 2020, it's, 2020 was the year of the nurse. And, it truly was, in every way, shape, and form. And I think that if we didn't realize how important nurses are, based on all of this, then we've learned nothing, and I don't think that that's true. I think that the world has taken notice. It's sad that certain healthcare systems still haven't caught up, but that's because of financial reasons. Obviously, it benefits them to not give us the importance that we deserve, because that means they would have to pay us more, obviously, and respect our time and not put us in unsafe situations. But yeah, if you value profits over people, that's what's going to happen.
Unfortunately, that is the truth. And thank you for breaking that down as well. So can you share, because I know a lot of nurses in the Bronx, there's a lot of people that feel overwhelmed still, even a year after, and like you said, have turned to other avenues in order to make funds because of the overwhelm. Can you share how lack of self-care and lack of balance while caring for others affects nurses like yourself, especially during these tough times?
Oh, absolutely. There's no way that it doesn't catch up to you, as it's not about being strong. It's about being human. And there's no way that seeing all of this does not affect you. I think right now an overwhelming feeling has been frustration. And I don't think that was something that was happening before. I think more it was, devastation before. I think it was sadness. I think it was anger. But I think frustration comes to mind as a big emotion for us because there's lots of, reasons to be frustrated at healthcare systems that aren't resourcing us properly, frustrated at people that are refusing to take the vaccine and then end up incredibly ill. I see on social media every day nurses talking about how they can't, they are, how do I say this? There's limits to modern medicine. And so we are frustrated by the fact that we know that people may pass and that there's limits to what we can do for them. I see everyday nurses, especially in Florida and places like Missouri and places that have been really hard hit right now, that they're seeing patients crying at the last moment and struggling to breathe, and they're using their last breaths to be able to say, "Can I get the vaccine now?" And I haven't seen that myself, but I cannot imagine how difficult that must be. It makes my hair stand on end. It breaks my heart. Stories of labor and delivery nurses. Labor and delivery nurses have been huge right now. They're actually delivering via cesarean section under like babies that are not full term yet because they have to intubate moms. And so, like I said, I saw it, I dealt with it a year ago. I can't imagine. Like, I can't. You think you're prepared and I want to go help, but even thinking about it now, it's like you just know how difficult it's going to be. There's a lot of bracing, I'm going to have to do a lot of bracing myself to see what's coming next. It's so difficult.
It's one thing to hear about it, but it's another thing to actually experience it firsthand. And, that's something that a lot of the population hasn't been able to witness. So they don't understand the capacity of like how much this affects a person. Before we go, nurse, I wanted to ask just, here in New York City, we're preparing to welcome children back to school. What is the best advice you can give to parents and, just adults and children to protect ourselves from this surge that's happening due to the Delta variant?
Yeah, well, I definitely think that, there's lots of questions. What's, for the future? Basically, what is coming next? Things change every day. I think that parents need, first of all, I commend parents, I have to say, for just dealing with everything that they've had to deal with. I'm not a parent myself. I can't imagine how scary it must be to have your kid out in the world at this point. Because of so many things that are happening right now. But parents, definitely the best thing you can do is pay attention to what's happening in your area. Pay attention to what your local health authorities are telling you. Sometimes things are not appropriate at like a state level. For example, like in New York City, Governor Cuomo and Mayor de Blasio have had really different views on how to handle lots of things regarding the pandemic. So, but I definitely think that's something that Governor Cuomo said the other day was really smart when he said, pay attention to what your local health authorities are telling you, because they're going to be the ones that know what's happening at the district level. So keep in touch with current events. Keep talking to your school authorities as well. We have to put pressure, I think, on the Board of Education to protect our children. I think there's no question about that. Just like we look towards, our local government to protect us as citizens, I think we have to look at the Board of Ed to protect our students going back to school. It's definitely going to be respiratory season that's coming up in September. Lots of colds. The weather is going to get cooler, so people will be inside. I definitely think that there's going to be lots of challenges ahead.
Yeah. Thank you so much, Nurse Nadia, for your time and for your expertise on this topic. And take care. Be safe out there.
Of course. Thank you so much, Sandy.
Of course. We're taking a quick break. We'll be right back here on Open BXRX Tuesday.